Welcome. My name's David Nicholson. I'm the NHS Chief Executive. Part of the change of the government was the bringing in of Lord Darzi as Health Minister and a commitment by the new Prime Minister and the Secretary of State to take the NHS forward to its next stage. This is a fantastic opportunity, a great conference. I'm really excited about what will come out of it. The prize for us is absolutely immense. So have a great conference. Thank you.
It really is a pleasure for me to be here today. I'm President and CEO of the Montreal Regional Health Authority. A reform was implemented, and today I'd like to talk to you a little bit about that reform, some of the key issues, and how we're trying to bring that reform down to the clinical level. I'm very proud of what we're doing in Quebec, and I wanted to explain to an English audience. I think what's being done here is very similar, the notion of an integrated healthcare model. I also wanted to learn from the review, and the fact that this focuses on involving clinicians and clinician leadership. I think that's probably the key to what we haven't done in the past. So if you focus the review on what is the role and how do we involve the clinicians, you probably be very successful.
The National Committee for Quality Assurance, which is just a big oversight organization.
So we have to find rules, we have to find ways in the society.
Achieve happy patients, happy doctors, and improve costs.
El Policlínico es el coordinador fundamental de todas las atenciones.
Almost all the Western countries are facing the exact same issue, which is as we transition from hospital-based care to outpatient care, we need to make adjustments in our delivery model. And it's been exciting to be part of that transition in the U.S.
I've been here for 3 days and talked to a lot of people, and I think the country is really on a roll. I think they're looking at the right things and doing important work. A lot of momentum and enthusiasm around change.
Worldwide, healthcare for the Western countries is becoming very similar. They face the same demographic problems with the aging of the population, and I think that the National Health Service can learn from other countries as we can learn also from the National Health Service. There are many opportunities for international collaboration. After all, the world is becoming very global.
Thank you. This is Clare House, where I'm a partner. There's 10,400 patients, 6 whole-time equivalent partners. We all have a job involved in the minor injury unit in the hospital. We all also admit to the wards. In addition to that, 5 of us have hospital practitioner roles within the hospital. I do 3 lists of anaesthetics a week, and I've also had a role in training up our MIU nurses.
What we've achieved in Bradford so far, in major part, is as the result of the significant clinical leadership that has been driven by many clinicians in Bradford, both doctors, nurses and allied healthcare professionals across primary and secondary care and social care.
It's my great pleasure to introduce Sir Liam Donaldson, our Chief Medical Officer.
Healthcare in this country and many others isn't as safe as it should be yet, and healthcare quality isn't at as high a level as it can be. We need to reframe the delivery of healthcare in this country. It's in all our hearts, it's what we set out to do, but it isn't necessarily the way the NHS always operates. And that reframing, I think, is a thing which I know that, judging by the discussion today and the questions you've been asking, is absolutely central to what you would like to see happen in Ara Darzi's review.
One of the most important roles that leaders can provide is in the innovation agenda. It's very easy for large organizations to lose their innovative edge. I think it would be fair to say that that's been true in the NHS.
And doctors who force confrontation with government over the needs of training, pay, terms and conditions are not leaders. They're representatives of their professional bodies.
Enablers are absolutely critical. It's not just the what. It's not just the clinical pathway, it's the how. So what we did when we were first given the mandate to care for these patients is develop our own integrated web-based information systems.
And then the beauty of innovation in an open world like this is, if you learn something in Birmingham and are willing to share it, we can use it in San Francisco.
So what I've been talking about is what we call LTCII, Long-Term Condition Information Integration. Thank you.
part of our group is looking at outcomes, and that's a bit we're probably weakest on at the moment. But there must be measures for COPD, quality of life, heart failure, quality of condition-specific measures.
No. GPs and health visitors aren't in the same place now, because the health visitors have all been taken out of the GP surgeries and put into children's centres.
We've got to have the resources, or maternity matters will not be successful. We've got to have the midwives, we've got to have the resources.
I'm really worried that we keep talking about acute care as just about admission avoidance, because otherwise, if they're not careful, you'll end up with all of these patients trucking up to A&E that at the moment most of them are going to their GPs about.
Having your own records actually gives you a huge, it's hugely empowering, but also it gives the patient the responsibility to take control and to do far more for themselves as well.
3 words, ownership, ownership, ownership in our views. Mental health service development needs to be owned by service users, owned by the community, owned by clinicians, and owned by people in administration.
It's been really exciting. It's been a great opportunity to hear different people's ideas.
It's been very interesting to see the whole range of health representatives that are here.
It has energized people, and hopefully if this carry on.
I think it's been useful to hear views from around the country and around the world.
I think the Cuban picture was really interesting.
I was very interested to hear the German presenter.
I think we can take the best bits of several of the models that are presented and learn a tremendous amount.
No, things take a long time to do, but I'm confident we can make a jolly good start.
Confident that we will make steps in the right direction and improve the patient pathway.
I'm optimistic, but there are uncertainties, there are fears about what might come out of it.
I think Lord Darzi needs to bring this event and harness it to the already good work that's being done in some other policy areas.
This is the exciting bit, is the review done at a local level. So I've had an opportunity to meet the clinicians involved in all parts of the country.
This is about engaging clinicians and the public and patients, but clinicians predominantly, in the next stage of the journey.
Talking about clinical models of care, it's led by clinicians, we're talking about evidence base, and that is what the NHS is all about.